angry. I'm upset because I'm like, I voted for you. Like, I put myself for you, and here you are, and you're basically embarrassing me as the American people. Like, you said that you want to come in here and make America great again, but you're not. You're making the elitists great again. You're making the people with money great again. It's very disheartening, and it's scary because I did vote Republican this year because based off of, the things that Trump had said and the things that Bobby Kennedy had said. Trump's statement about not touching Social Security, not touching Medicaid, that was all going to be safe, secure, nothing was going to be happening to those things. And then now here we are. It's very frustrating. It's very, I'm angry. That's not making America great again.
Here's something you don't hear every day. A Trump voter feeling betrayed by Medicaid cuts. They put their faith in the promises made only to see those promises turn into broken lifelines. Medicaid isn't just some government program for millions. It's a difference between getting medicine or going without, between keeping a roof over their heads or falling into crisis. Now, the so-called Big Beautiful Bill just passed the House. It's loaded with funding for defense and deportation, but Medicaid, Medicare, and food assistance, those are getting slashed very hard. This isn't a hypothetical issue. It's hitting home for a lot of folks who never thought it would. Let's dive into our real reactions from people living this reality and what it means going forward. This is the Ask. Please like and subscribe so you won't miss any video we upload. Let's go into those reactions.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most.
It bothers me when people like Elon Musk say that people on those programs are the parasite class. It's just cruel.
Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
Trump promised a lot of things. I thought it would be more family values and those programs that we really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare, Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
But his administration just proposed an $880 billion cut to Medicaid over the next 10 years. So we wanted to come here to find out how people are feeling about Trump and his administration's decision that could have a huge impact on one of the benefits they rely on the most. One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy.
You can hear the panic in their voice. This is real fear, not political talking points. They thought these cuts wouldn't affect them, but Medicaid was their safety net, and now it's disappearing. This is what happens when voters support policies that hurt them, without realizing it until it's too late. This fear and betrayal isn't isolated, it's becoming a pattern, and it's only getting worse. Let's continue watching more reactions.
We have breaking news coming in that President Trump's described big, beautiful budget bill has just passed the House after a marathon all-nighter debate. The bill passed with a 215-214 vote. That bill includes more money for defense and deportations, but cuts for Medicaid, Medicare, and SNAP benefits. It also keeps the president's tax structure from 2017 from expiring at the end of the year. The president's budget changes estimated to add nearly $4 trillion to the national deficit. The budget now moves to the Senate for a vote there.
The One Big Beautiful Bill also provides critical protections of Medicaid through common sense efforts to eliminate waste, fraud, and abuse. And the 1.4 million illegal aliens who are currently improperly receiving Medicaid benefits will be kicked off the program to preserve it for hardworking American citizens who need it.
Guys, we've got some breaking news. It passed by just one vote. Trump's One Big Beautiful Bill Act has passed very narrowly by just one vote, 215 to 214. So if you're not a billionaire, a defense contractor, or part of Trump's cabinet, congrats, you just lost. This 1,000-page monstrosity includes $800 billion in cuts to Medicaid, new work requirements that could strip millions of health care, massive and permanent tax breaks for the wealthy, a $1,000 Trump baby savings account. Yeah, that's a real thing. $150 billion to defense and $46 billion to militarize the border. And they even got rid of the $200 tax on pew-pew silencers because apparently that was urgently needed. And they passed this on the same day that Representative Jerry Connolly, a Democrat from Virginia, passed away. A man who would have voted no. They didn't pause, they didn't wait. They counted his passing as their advantage, and they ran with it. This is how fascism functions. Smiling while gutting healthcare, celebrating while people lose coverage. By the way, they literally chanted USA, USA, and calling it beautiful while the working class suffers. But it's not over. It still has to go through the Senate, and until then, we're expecting major revisions. So please, guys, I challenge you to do this. Call your representatives non-stop today, all the way up until and even after the vote tomorrow. Otherwise, we're just letting them pass cruelty without even putting up a fight. They don't need you to be Republican or Democrat. They just need you too tired, too overwhelmed, or too numb to do anything about it. So let's shake this loss off, because it was one vote. It still has to go to the Senate. There is still hope. Let your voices be heard. I beg you. So please like, comment, share this video, give it all the boost. Follow me for updates, and I do send my, thoughts and sympathies to Representative Connolly's family.
This is the moment people start to wake up and push back. The government tries to sugarcoat the bill, but the cuts are real and devastating. You see that fire in the lady's voice? That's the anger and the urgency that's breathing in communities. If people don't stand up now, these cuts become permanent and the damage will be irreversible. This is a call to action, and it's just getting louder.
Good morning. So like many others of you, we woke up to the news that Trump's big, beautiful bill passed 215 to 214 overnight. If we'd had one more decent Republican vote against it, we wouldn't be in this situation. And it's really hard to go into work right now. I'm a teacher and act like everything is normal when we're just about to enter some kind of crazy dystopian nightmare. But I mean, this is doing exactly what they want. They want you poor, uneducated, and sick, because you can't fight back when you're so focused on those things. And for everyone who's like, we'll take care of it at midterms, oh, it's just 4 more years, I have a question. Do you really think we're going to have another normal election at any point? Republicans seem to have no fear about voting for things that are going to kill you. Why is that? Why is it that they think you can get away with not having town hall meetings, without listening to you? They have no fear of not being reelected. Trump has literally said the presidential election was rigged numerous times. He has said, if you vote for me now, you will never have to vote again. Why do you think all of that is happening? And I'm curious. I would love a discussion on this from both sides. Do you think we are going to have any more normal elections? Or is this it? This is where we're at. Because I don't think we're going to have any more normal elections. And that is terrifying. And now I'm going to go inside and teach and act like everything's normal, which makes me feel insane. Have a great day.
My father has stage 4 Parkinson's. We decided 5 years ago that we wanted to leave West Virginia because it was such a red state, and we came back to North Carolina. I live in Moore County in Aberdeen, North Carolina, and I was so excited to hear Kamala Harris talking about allowing Medicaid, Medicare to help people like me that have my parents in the home so that they can get the care that they need. And that's not going to happen anymore. And that's the reason why I'm in this race. My daughter was born with hip impingement syndrome and scoliosis. Her spine is in a cage. If my daughter was to get pregnant, it could kill her. And we have a regime right now that would let my daughter die. I cannot accept that. I will not accept that. And I will tell you, if you send me to Washington, D.C. to represent you in Congress, I will put boots on the ground often. I will absolutely, let me tell you something. Mission means something to me, and I put boots on the ground. Thank y'all very much. Ojeda from North Carolina's 9th Congressional District.
So I wake up and I see that the big ugly tax bill has passed in the House. The tax bill that is going to cut Medicaid, Medicare, food stamps, just kill people. This bill is just going to kill people and take away the things that they need just to live, just to survive, right? And I know I've been covering the vote this week. I've also been doing my day job because I do still, thankfully, have a day job at the FDA, right? And this video is me speaking in my personal capacity, not on behalf of the FDA. I'm going to talk about everything that's going on when it comes to attacking healthcare in this country, because I feel like there's so much crazy shit that we're forgetting about the dismantling of the federal agencies, and that's still going on. Okay, so I'm going to talk about just the FDA, and I want you to remember they're slashing and burning all of the Department of Health and Human Services while also taking away health care from 14 million Americans. Okay, the FDA at its full capacity has 18,000 employees. It is located in Maryland. It is not the largest health care or public health employer in Maryland. It's actually Johns Hopkins. Johns Hopkins, which is one hospital system here, and it has about 30,000 employees by comparison. The FDA's 18,000 employees, that is all 50 states internationally, and that is to regulate 20% of this country's GDP. You want to talk about economy? It's $5 trillion. And it costs about $3 billion in taxpayer money to fund the FDA. So you're talking about $3 billion to get a $5 trillion return on investment. And it's not just about money, right? It's about lives too. So because of the slashing and burning of the FDA workforce, which was already running crazy efficient with the staff that they had, they needed to increase employees at the FDA, not decrease, okay? But yeah, so they have cut so many staff that the Center for Drug Evaluation and Research cannot properly communicate drug safety information. There's not enough people to do the work to make sure that drugs are safe and effective. The Human Foods Program, that's like, they regulate the food. FDA regulates 80% of the food in this country, okay? They just went in and cut a bunch of people, including folks who make sure baby formula is safe. And not only did they cut those people who make sure baby formula is safe and go after bad actors, they put this guy, Kyle Diamantis, in charge of HFP, okay? He's not a scientist, not a public health professional, not a doctor. He's an attorney who represented the baby food companies when they were accused of not properly disclosing the elevated risk of a deadly bowel disease in premature babies. He defended them against that, and now he's in charge of the safety And so I just want to put this out there this morning and remind folks of all the ways that the Republican Party is just going to kill Americans. Like they're really just trying to kill working class people.
This is where it all lands. This wasn't some budget tweak. This was calculated. Clip after clip, it's clear this isn't just about money, it's about control. Keep people poor, uneducated, and sick. Because if they are struggling just to survive, they won't have the strength to push back. But then you see that guy who moved to a blue state to protect his daughter, his father, and himself. That's real. That's someone taking action because survival became political now. And then we hear it plain and simple. This Medicaid cuts will kill people. That's not drama, it's a warning. Healthcare shouldn't be partisan, it shouldn't be a punishment. But in 2025, that's exactly what it has become. This is beyond party lines, it's about life and death. And for many, the clock is ticking. This isn't just a political as usual. It's about survival, health, and dignity. These Medicaid cuts are dismantling the safety nets millions rely on. People who voted a candidate promising to protect their interests are now facing the consequences. Some are realizing the truth and making changes, like moving states, voting differently, and raising their voices. Others are still stuck defending a system that failing them. The stakes couldn't be higher. People's lives are on the line. If this video made an impact, hit the like button, subscribe for more real talk, and share it loud. Because understanding the cost of these policies is the first step to push back. Let's keep the conversation going. Let me know in the comment section what you think about this policy. Bye bye. See you to the next one. Love you. Wish you peace and love. Bye bye.